Hi, hello everybody. Thank you so much for coming to today's Leaders Initiative seminar. My name is Stephanie and I will be moderating things here on the back end. I will be sending out an evaluation link later on during this talk, so please take the time to fill out the evaluation. We very much value your opinions. And I am very pleased to present our speaker today, Dr. Courtney Polenic. She is an assistant professor in the Department of Psychiatry at the University of Michigan. Dr. Polenic's research focuses on family relationships and caregiving in the context of complex care needs, including dementia and multimorbidity. She is particularly interested in understanding family influences in everyday life that inform stages to improve the well-being of people living with dementia and their care partners. So without further ado, I will turn things over to Dr. Polenic.
Great. Thanks so much, Stephanie, for that very nice introduction. And good afternoon, everyone, and thank you so much for joining us today. So I'm excited to share some research on how the daily experiences of people living with dementia and their care partners influence well-being in both members of the care dyad. So to start off with a little bit of background, we know that most research on people living with dementia or being a care partner for these individuals focuses on individual characteristics, such as an individual's stress levels, and individual outcomes, such as depression, and how individual characteristics influence individual outcomes. We also know that people live in the context of their close relationships, and for this man, his closest tie might be with his wife. We typically don't think about characteristics and outcomes related to close others, such as spouses' stress levels and depression. But we know that health outcomes such as depression are often very strongly associated within close relationships, meaning that if one partner in a dyad has high depressive symptoms, the other partner also may have higher depressive symptoms. And the characteristics of close others often influence individual outcomes over and above that individual's characteristics. And when we don't consider these mutual influences that are occurring within close relationships, such as how partners might affect one another's depression, we may be missing out on key information about factors that impact well-being and could enhance clinical care and interventions to support people living with dementia and their care partners. So a lot of my previous research focuses on these mutual health-related influences among middle-aged and older couples. And the marital relationship is especially important to consider because over 2/3 of adults are married in middle and later life, and spouses are a major source of health-related influence and support. Spouses usually live together and share daily routines, so they can play a key role in shaping one another's mental and physical health as they age. My colleagues and I have done some research using data from the Nationally Representative Health and Retirement Study, which is the largest ongoing study of adults aged 50 and older and their spouses or cohabiting partners. And we found that when husbands report higher pain intensity, their wives report increased depressive symptoms over 8 years. And we think this might be because wives generally provide more support in managing their partner's health problems, such as chronic pain. And over time, this might have a negative impact on wives' own mental health. We've also found that when wives have higher depressive symptoms, their husbands develop a higher number of chronic conditions over 8 years. And this might be because husbands often rely on their wives for support in managing their own health and preventing future health problems, and wives may be less able to provide the support when they themselves have poor mental health. Finally, our studies from a recently completed NIA R03 project indicate that when couples manage more complex chronic conditions that require a wider range of self-management strategies, so for example, managing pain for arthritis, along with other things like lowering blood pressure and monitoring blood sugar levels for diabetes, they actually report higher depressive symptoms, lower physical activity, and more functional disability over 8 years. So taken together, this research suggests that middle-aged and older spouses affect one another's mental and physical health over time. And importantly, that chronic illness has a long-term impact among both individuals with chronic illness and also their partners. But these findings don't really tell us what strategies couples might use to manage their chronic conditions, especially when one partner lives with dementia and both partners are navigating health problems. And it's really important to think about couples where both partners live with chronic conditions, because we know that about 60% of adults age 18 and older in the United States report having at least one chronic condition. Further, 42% report having two or more chronic conditions. And the prevalence of multiple chronic conditions increases to 80% of adults age 65 and older. And this is a concern as people age, because we know that multiple chronic conditions can have a negative impact on both mental and physical health. Our previous research led us to a recently completed study of couples managing multiple chronic conditions called the Self-Management, Health, and Resilience in Partners study, also called the SHARP study. And the purpose of this study was to better understand the experiences of couples where both partners are living with two or more chronic health conditions. We were interested in learning more about how both partners manage their chronic conditions as individuals and what they do as a couple to manage their conditions. This study includes 56 married or cohabiting couples where both partners have at least two chronic conditions and at least one partner is 50 or older. We included a subsample of 15 couples where one partner lives with early or mild symptoms of dementia, because these couples may have unique challenges with illness management. And we separately interviewed both partners by phone about how they manage their chronic conditions individually, as well as together as a couple. And this interview included open-ended questions to better understand their unique experiences. And next, I'll share some of the questions and responses from these interviews with you from our subsample of couples living with dementia. One of the questions we asked was, how do the conditions that you and your partner have affect your relationship and the things you do together? So in this couple, the husband living with dementia shared, I think they've strengthened our relationship. I think we both have to help each other. I have no sense of direction, and I'd be in big trouble if I had to get myself to meetings and stuff. And she has infinite ability to, I think she has a built-in GPS. So this really indicates that both partners are helping each other in managing their chronic condition, especially in areas where one partner might be experiencing some difficulties. And this is a very common pattern that we saw in our couples. A husband living with dementia also noted, well, I mean, first of all, we have to, both of us avoid doing anything to hurt, either physically or verbally, and we try to share the work and try to make life good for each of us. And this response also indicates a sense of shared responsibility for managing chronic conditions that we have seen in many of our participating couples. A wife living with dementia told us it's very positive. As I said, he reminds me mostly, have I taken my medication? I don't think I've ever had to remind him for taking his medication. He goes to the doctor regularly, he eats properly, he eats breakfast every morning, and so he manages his daily eating habits very well, and I have no complaints. So for this couple, the partner living with dementia is receiving a little bit more help than her husband, but she does note that he's taking good care of his own health, and she doesn't feel that he needs reminders from her. A wife whose husband lived with dementia told us, I think it affected our relationship by actually bringing us closer together, because we have each been concerned for the other on other major problems, and we try to be supportive. So these feelings of mutual support and oftentimes greater closeness as a result of managing chronic conditions together are other common themes in our responses. Another wife whose husband lives with dementia shared, I had to take on some additional roles, and more certainly increased my need to overview everything, oversee everything, and make sure that things are getting done that need to be getting done. She went on to say it certainly affects what each of us are able to do. And then it requires patience from the other one and understanding in doing anything. And these responses reflect that this wife is taking on greater responsibility in managing her husband's health as he lives with dementia, but that patience and understanding from each partner is really important in navigating these health limitations within the couple. And we had a wife of a husband living with dementia tell us, I've learned that I have to keep myself healthy and resilient. And since I'm really the manager of our lives, and learning that we have to find joy in the moment and live each day to its fullest has been a more predominant priority. So this response underscores the need for care partners to prioritize their own health and self-care, along with focusing on positive experiences in the care relationship and things that they do with a partner living with dementia. We also asked both partners, what do you and your partner currently do together to manage health conditions? A husband living with dementia told us, just keep track of each other and make sure we remind each other to do what we are supposed to do. And this further demonstrates that partners are often helping one another with the things that they need to do to manage their health conditions. Similarly, a wife living with dementia shared, I know I have accompanied him to some appointments. He would do the same for me, just kind of keeping an eye out for each other at our meds, making sure we're taking them and not running low on them and that sort of thing. We just kind of double check on each other. Another husband living with dementia shared, forgetting things that I do to manage my conditions, and she has to remind me about things that I forget. So as we anticipated, many participants living with dementia mentioned that they frequently do rely on their partners to remind them to do things like taking medication and following a special diet to manage their health conditions. Many participants living with dementia also commented about their partner's primary focus on helping them manage their conditions. So as one husband living with dementia noted about his wife, she puts a lot of time into my conditions. A husband whose wife lives with dementia similarly noted, it's all time. When I take the time out to exercise and do what I need to do, it takes time away that I have to spend with her, and just the opposite effect. So this response really captures the challenges that are experienced by many care partners of balancing the time that they spend helping their partners with doing things, the things that care partners themselves need to do to manage their own health. A wife whose husband lives with dementia commented, sometimes my jazzercise, if I have to go away for the class, I don't think I would be as comfortable with that just because I'm not here to navigate a project he might be doing to fix something up. I'm usually involved in helping find tools or making sure it's a good, reasonable choice of a project. So if anything, it's brought me awareness to how during this last year coincided with recognition of how we need to do more things together, situations that are safe and practical. So for this couple, it was helpful for the wife to try to do more things with or near her husband to make sure that they're both able to do things that are important in managing their health and well-being. Another wife whose husband lives with dementia shared, well, as I said, we exercise, take walks, typically do things together. So just try to keep active and keep positive attitudes. And this response also indicates the value of doing activities together, such as exercise, that are beneficial to the management of both partners' health. And it also suggests the importance of helping each other to maintain a positive outlook while living with dementia and other chronic conditions. And a wife whose husband lives with dementia told us, I mean, when we started this, there was a lot of arguments. He would argue that I was giving him the wrong pills or too often or something like that. He's relaxed a lot on that. He has an awful lot of doctor's appointments. I just recently decided that I need to make sure that I make my routine and appointments, like for dental care and things like that. So this shows that some couples do naturally experience some tension in the relationship as one partner is starting to help the other more with managing chronic conditions, and they need some time to adjust these changes. It also highlights the critical importance of making sure that both partners are taking the time to do the things that they need to do to manage their own health, such as engaging in preventative health care. Another question we asked was, how do you and your partner cope together with the stress of having health conditions? A husband living with dementia shared, we talk about it a lot. It helps. I mean, it's out in the open, it's not separate. We discuss it, and I try to, when we have doctor's appointments, I try to have her go with me. For the most part, sometimes she likes me to go with her, but sometimes she doesn't. So it's fine. So this response suggests that it's often beneficial for couples to share their feelings about managing their health conditions and also attending one another's doctor's appointments, one that's helpful and agreeable to both partners. Similarly, a wife living with dementia told us, we talk about things as they come up. We sit, we have breakfast together every morning, and we both do what we have to do. And in the evening, we watch TV together. So we're together all day, but mostly in each other's presence, certainly morning and evening. We both enjoy it. So this response suggests the importance of talking about issues related to managing both partners' health conditions, as well as just spending time together and being there for one another. A husband living with dementia noted, well, when you are concerned with a person, you try to accommodate, try to help in any way, try to help and to remind somebody, for example, did you take your pills and whatever, just to accommodate. So this response again shows that care partners often support one another by providing help or reminders in managing their health conditions, and this can help to manage stress related to coping with health conditions. Another husband living with dementia told us, I think just the desire to keep going and accomplish more things and so on is key. And we are active in the church, and that's a help too. This response shows that the importance of both partners staying active and engaged with activities that they enjoy doing and are restorative in managing their health and well-being. A wife whose husband lives with dementia shared, I think being informed and having a sense of humor. And this indicates the value of education or knowledge in how to manage dementia and other chronic health conditions, along with being able to maintain a sense of humor in the couple's relationship. Another wife whose husband lives with dementia noted, as I said before, I'm more positive. I have more of a sense of humor. And I think that helps keep us on a level of it is what it is and we're going to deal with it, as opposed to getting upset and frustrated with it. So this suggests that having a sense of humor and staying positive can help both partners keep things in perspective as they manage their health conditions and stress related to these conditions. A husband whose wife lives with dementia shared, we love each other very much and we try to be helpful to each other. And we're good listeners for each other too, while we're considerate of each other also. So this suggests that listening to one another and being supportive of one another are helpful strategies for couples living with the stress of managing chronic illness. Finally, a wife whose husband lives with dementia told us just recognizing what we can do rather than what we can't do, and then making the most of that. And this really shows the importance of focusing on each partner's strengths and abilities instead of their limitations in coping with stress related to managing dementia and other chronic conditions. Next, I'd like to share some preliminary findings from my K01 project called the Couples Wellbeing and Everyday Life Study, or the CWEL study. And the purpose of this study is to evaluate mutual influences in daily stress, self-care, and well-being among couples living with early dementia. So for this study, we recruited a total of 40 married or cohabiting couples in which one partner lives with early dementia. Both partners separately complete one baseline phone interview about their sociodemographic and health characteristics, their daily stress, and their well-being. And couples also completed daily assessments to get a better understanding of daily stress processes, such as emotional reactivity to stress, which may be important targets for interventions to support couples living with dementia. Both partners separately completed brief morning and evening phone interviews. And in addition, they collected saliva samples 4 times a day for 4 days, so we can examine physiological reactivity to daily stress within couples. So next, I'll share some preliminary findings from a subsample of our first 12 couples who completed these daily assessments. So for this study, fortunately, we had very high completion rates for the daily morning and evening interviews. The morning interviews were about 5 minutes and the evening interviews were about 15 minutes. And we found that 99% of these interviews were completed by both partners. We also had very high rates of saliva collection completion for a total of 98% of samples completed. We also found that people living with dementia reported negative events during their day. So these are stressful things that are unrelated to living with dementia on 35.7% of their days and positive events on 91.7% of their days. And we found that spouses reported negative events a little bit more frequently, so about 63% of their days, and they reported positive events on nearly every day, so 96% of days. We also found that there's significant inter-individual variability across the 7 days in daily positive and negative mood and in daily positive and negative events among both partners. And this indicates that both partners vary considerably in their daily experiences across days. So just to illustrate this, these spaghetti plots are showing mean positive mood by day for people living with dementia, and mean negative mood by day. And what this is showing is each individual color represents an individual participant over the 7 days of data collection. So you can see in both of these figures that participants were varying quite a bit, both between participants, but also within participants across days. We're seeing a lot of kind of ups and downs for some participants, where others are a little bit more even across days. But we are seeing significant inter-individual variability in these reports. And very similarly, we see significant inter-individual variability in the daily number of positive and negative events over 7 days in people living with dementia. So the left figure shows the number of positive events by day and how that's varying across 7 days within individuals. And the figure on the right is showing the number of negative events by day reported by people living with dementia and how that is varying across the 7 days. And interestingly, we see especially a lot of variability in the number of positive events. And we see similar patterns in spouses of people living with dementia. So these two figures are showing daily positive and negative mood over 7 days in spouses. And again, you can see that there's significant inter-individual variability for both positive mood by day over 7 days and negative mood by day over 7 days. And very similarly, we see this same kind of pattern for daily positive and negative events over 7 days in spouses of people living with dementia. So again, the left figure is showing the number of positive events by day over 7 days, and the right figure is showing the number of negative events by day over 7 days. And you can see for both, especially for the number of positive events, we're seeing a lot of variability within individuals across days. And this figure shows the correlations between each partner's reports of daily negative events, which we measured both in terms of the sum of daily negative events and their perceived stressfulness, and their reports of daily negative mood. And we found that more negative daily events reported by people living with dementia, both the sum of daily negative events and the perceived stressfulness of these events, are associated with higher daily negative mood among people living with dementia, and also among their spouses. So we're seeing that people living with dementia are affecting themselves, but then also their partners in terms of more negative events are associated with more negative mood. Similarly, we find that more negative daily events reported by spouses of people living with dementia are linked to greater daily negative mood for their partner living with dementia, as well as their own greater daily negative mood. So these findings indicate that both partners' perceptions of daily negative events have implications for daily well-being in both members of the care dyad. So you're affecting both yourself and you're affecting your partner. And this really highlights the value of assessing the daily experiences of both partners when we're trying to understand daily stress processes among couples and other care dyads living with dementia. Finally, I'd like to share some findings from another recent pilot study focused on the daily experiences of couples living with dementia. And the purpose of this study was to examine the feasibility and acceptability of ecological momentary assessments and wrist actigraphy devices to objectively measure sleep and activity patterns among people living with early dementia and their spouses or cohabiting partners. This study included a total of 10 married or cohabiting couples in which one partner lives with early or mild dementia. Both partners separately completed one baseline phone interview, followed by 7 consecutive days of ecological momentary assessment, smartphone surveys, and wrist actigraphy using the ActiWatch Spectrum Plus. Both partners also completed one follow-up phone interview to assess the feasibility and acceptability of the daily assessments. And these interviews included both scaled and open-ended questions about the smartphone surveys and the wrist activity monitors. So just to give a few examples of what the questions looked like on participant smartphones, We asked some questions, for example, thinking about the past 3 hours, how worried or nervous did you feel? And people could select on their phones their response. We also asked some questions where people could select more than one response if it was applicable. So for example, asking about physical symptoms that they might have experienced. And then once participants finished taking their smartphone survey, they would receive a message thanking them for taking the survey and letting them know that their response was recorded. So in this study, we found that 100% of participants completed their baseline and follow-up phone interviews, and all agreed to participate in the smartphone survey and wrist actigraphy portion of the study, which was great. We found very high completion rates for the smartphone surveys. So for people living with dementia, 85% of surveys were completed, and for spouses, 93% of surveys were completed. And for wrist actigraphy, people living with dementia, 94% of days had complete data, and for spouses, 96% of days had data. Compliance was also very high for the ActiWatch Spectrum Plus. And okay, again, this is just showing that 94% of days had data for the actigraphy. For people living with dementia, and for spouses, 96% of days had data. So just to show a little bit of the follow-up survey data, assessing feasibility and acceptability of these procedures. So we asked, how would you describe the number of days of surveys? So as a reminder, we sent surveys for a total of 7 days for the study, and people could report whether they felt this was too few days, just about the right number of days, or too many days. And fortunately, we found that for the most part, people said that the number of days of surveys was just about right. We did have a few people living with dementia and spouses who felt that it was too many days. But fortunately, this is showing that a total of 7 days is generally pretty acceptable for both people living with dementia and their partners. We also asked, how easy was it for you to use your smartphone screen to answer the questions? And this ranged from not at all to a great deal, easy to answer. And fortunately, we found that for people living with dementia, most said that the surveys were easy to complete. We did get a couple who did have difficulties with completing the surveys, which suggests the need for additional training perhaps, or support to make sure that they feel comfortable in using the surveys on their smartphones. And for spouses, we had really most said that it was easy for them to use, either quite a bit or a great deal. We also asked both partners what was the best part of taking the daily smartphone surveys. So these are responses from people living with dementia. One said that the survey made them think a lot. They enjoyed taking the survey and thought the questions were good and interesting to them. Another person living with dementia told us that they had to know that the survey was going to come and had to be a little bit more aware of time than they would have. So they found that to be, kind of something that they appreciated. Another person said that just keeping track of how they were feeling and what they were doing was helpful to them. For spouses, we did get, this response was actually one that was pretty common in our sample. So a number mentioned that they liked the flexibility of taking the smartphone surveys as opposed to doing like a scheduled phone interview or in-person interview. So it allowed for a little bit more flexibility and allowed them to go about their day and take the survey when they were able to. Another spouse mentioned that it sort of just kind of helped them think more about where they are. And also what their partner is actually going through. So the spouse said it's a hard thing for him to get through each day. And so it's very easy for me to overlook a lot of things like misplacing or asking the same question. I can just put myself in his shoes. So I really look forward to doing it. And I think it helps me analyze how I'm dealing with or coping with what is going on. So just kind of being asked about, things that are happening during the day that are stressful, or things that the person living with dementia might be experiencing, just kind of help them be more aware of how they're coping and what they're actually, kind of dealing with in their day. We also asked what was the worst part of taking the daily smartphone surveys. So people living with dementia, one example A person mentioned that the worst part was just that the questions and surveys were a bit repetitive, and they just weren't used to the routine of taking so many surveys. So as a reminder, we sent out 6 surveys per day, which were relatively short, but it was, a frequent data collection, and we did ask some of the same questions. So the second participant kind of brought out that some of the items that we were asking about, so this feeling loved was one of our items that we asked about, kind of positive mood items, and they just kind of didn't always resonate with participants. So this person had commented that just kind of asking repeatedly, how loved do you feel, didn't seem like something that was really useful in kind of reflecting what his daily experience was. So this was just kind of helpful in thinking a little bit more about the items that we're asking people, and especially repeated items. And is this something that we actually expect to change in people's days? So this was really helpful feedback. And then in terms of spouse responses, we did get a few comments that there were too many surveys a day. So maybe thinking about reducing to 2 or 3 times a day instead of every 3 hours might be a little bit easier for them to complete the surveys. Also, a few spouses mentioned that the number of questions might have been cut down a bit because a lot felt that they were repetitive or redundant. So for measures that we do want to make sure we're getting repeated assessments, for example, emotional well-being, this suggests that it might be helpful to explain to participants why we're asking repeated assessments, because we're interested in seeing how mood changes throughout the day. So just explaining why there's a need for repetitive items might help to explain some of these concerns. Also, one spouse mentioned that they disliked that their husband was asked about his experience in the past 3 hours, and this was difficult for him to remember. So this also suggests that for smartphone surveys given to people living with dementia, it might be better to ask them what they're experiencing in that moment, as opposed to the past 3 hours or another given time frame. And one spouse mentioned that the worst part was trying to find the time to do it. They mentioned that sometimes they'd sleep through the first survey, and then they'd worry about missing that and trying to kind of get caught up to where they were. So thinking about kind of the timing of the events and maybe adapting that somewhat to participant sleep schedules might be beneficial. We also asked, how would you describe the number of days of wearing the wrist activity monitor? Again, ranging from too few to too many, and also just about right being another option. And we found for this that fortunately both people living with dementia and their spouses felt generally that it was wearing a wrist monitor, which is very similar to a watch, was really fine for 7 days. We did have one spouse who felt that it was a little bit too much. How comfortable was it to wear the wrist activity monitor? So again, responses could range from not at all to a great deal comfortable. And we found that most people living with dementia reported that it was comfortable. We did have one say that it was not at all comfortable. So again, maybe kind of a little bit more training prior to the study on what to do if you are experiencing discomfort, or how to make the device a bit more comfortable might be beneficial for future studies. For spouses, most said that it was comfortable, either quite a bit or a great deal. Although a few spouses also mentioned a little bit of discomfort in wearing the monitor. We also asked both partners how much did the wrist activity monitor disrupt their sleep, from not at all to a great deal. And fortunately, we found very little sleep disruption. So we only had 1 out of 10 people living with dementia say that it a little bit interfered with their sleep. So this was good to hear that overall, this was not something that interrupted their sleep. We also asked what was the best part of wearing the wrist activity monitor. And for people living with dementia, we got a lot of responses just kind of saying, I didn't really acknowledge or pay attention to the fact that it was there, which is good, because we definitely want people to forget that they're wearing the monitor. One person living with dementia just mentioned that they enjoyed being part of research and feeling that they're doing something that will really give us beneficial information to learn about other people living with dementia. And another person mentioned that they're very used to wearing watches. So it was something that they could easily incorporate into their daily routine and not really notice, which was great to hear. For spouses, they generally mentioned that the wrist monitor was easy to use, and one had mentioned they expected that it would be a bother, but it really wasn't too bothersome. Then we asked what was the worst part of wearing the wrist activity monitor. And for people living with dementia, some mentioned that it was a little bit uncomfortable to wear. Sometimes they have it on too tight or would start to irritate the skin. So again, this is really highlighting the importance of making sure, kind of checking in with people and making sure that they are, comfortable with using the monitor, and making sure that they know what to do if it's irritating their skin or feeling too tight. Another person mentioned that just kind of having to take it off to get a shower was a little bit bothersome, but it wasn't too big of a deal. Another mentioned just kind of having to have it on all the time was somewhat bothersome. For spouses, some mentioned that it was just a little bit, something that they'd have to be careful with and make sure that they don't snag their sweater, that sort of thing. One mentioned that it was a little bit bulky, but other than that, it was generally not bothersome. And another person mentioned just kind of the band was a little bit long, so they had trouble adjusting. So again, just things that would be helpful to discuss a bit more during training prior to the study beginning. But overall, we found in these responses that these procedures were generally, feasible and acceptable, which was really great. So just in terms of a summary of this research, so taken together, our findings demonstrate that spouses or partners influence one another's health and well-being in the context of living with dementia and other chronic conditions. We've also found that couples often help each other in managing their health, which challenges the common view that one partner is providing help while the other partner is only receiving help. In addition, we found that both partners experience difficulties, but also do show considerable resilience in living with dementia, such as maintaining a close and supportive relationship, keeping a sense of humor and a positive attitude, and reporting frequent daily positive events. And these findings may help to identify individuals who are most in need of support and interventions, as well as those who may benefit from a dyadic or family-based approach to improve their well-being. In terms of future directions, we do need to learn more about different types of couples. So our studies so far have only included opposite sex couples who live together, but we do need to learn more about how more diverse types of couples live with and manage dementia and other chronic health conditions, such as same-sex couples and those who are not living together. We also need to learn more about how other types of care dyads live with and manage dementia and other chronic conditions, such as older parents and their adult children. And finally, I'll share a little bit about some upcoming studies that we have based on these preliminary studies that I've shared with you today. So the first is a R01 study that was recently funded by the National Institute on Aging. And this is a grant to understand daily experiences among couples living with early stage dementia and how these daily experiences are impacting daily sleep. And then over time, how are these daily dynamics affecting long-term well-being and cognitive function in both members of the couple? And co-investigators for this project include Drs. Kira Burdett, Helen Burgess, and Ben Hampstead. Another grant that we just recently started is funded by the Alzheimer's Association, and it's focused on Black caregivers' daily experiences and how these experiences are impacting sleep in dementia care dyads. And this is actually also testing the feasibility and acceptability of 21 days of smartphone surveys for caregivers and 21 days of wearing a wrist activity monitor for both caregivers and people living with dementia. And then also we recently started a study funded by the Michigan Alzheimer's Disease Research Center. And this is a developmental project grant that is focused on daily experiences and well-being and co-resident adult child dementia caregivers. So these are adult children who recently started living with a parent living with dementia within the past year, and also perceptions of co-residence within dementia care dyads. So for this study, we'll plan to do semi-structured interviews with both members of the dyad about challenges and things that have been rewarding in terms of living together and kind of navigating that recent transition. So in addition to thanking our fantastic research participants, I'd like to acknowledge my mentors and collaborators, as well as my wonderful study team members and my funding and support from the National Institute on Aging, the Michigan Alzheimer's Disease Research Center, and the Department of Psychiatry at the University of Michigan. And I thank you so much for your time and welcome any questions or comments now or after the seminar today.
Oh, I see one question in the chat.
Great.
All right, it says, have you already or do you plan to incorporate the feedback in your recently funded upcoming studies? If so, do you think your results will change if this participant feedback, less surveys per day, questions about that moment instead of the past few hours were incorporated?
Yeah, so we, to answer the first part of the question, we absolutely are incorporating some of this feedback in our newly funded upcoming studies. In terms of whether the results will change, I think that would be difficult to kind of answer that, but I think, you know, our purpose for wanting to incorporate those changes are just to make it, you know, easier and more feasible for participants, and also to make sure that we're getting data that are, you know, more likely to kind of capture what we're really interested in. So for example, asking maybe about emotions in the moment might be a more valid way of assessing emotional reactivity to stress in people living with dementia. So I'm not sure how that would necessarily impact the results, but you know, potentially it could, but definitely we are taking that feedback into consideration. But thank you for the question.
Any other questions for Courtney? All right, well, if we don't have anything else, I did put the Qualtrics evaluation in the chat. So fill that out and I'll also send it in a follow-up email as well. Yeah, oh, Annalise says, amazing work, Dr. P.
Oh, thanks, Annalise.
And a thank you from Laura. Great. All right, well, thank you everybody for coming today. I'm going to go ahead and stop the recording if we don't have anything else. We can stay on here and chat for a few minutes if we need to.